Hi, I'm Tal Cohen, and today in this short educational video, I want to talk to you about where do you start when you get a new patient for either your functional medicine practice or your integrative medicine practice. And so during this short video, I'm going to give you some tips, useful tips, and kind of lay the foundation for new patients if you're just starting your practice of functional or integrative medicine. So let's dive into it. So I built a little process in which hopefully it will help you to kind of understand and wrap your head around how do you lead those patients. And ideally you want to have this process ready before you see your first patient in order to save time, in order to make the process really simple for your clients and your admins. So where you want to start your consultation, your medical review as we call it, is basically by asking your patients about their challenges. In our medical reviews or consultations, we actually have those guiding questions in the consultation form. So patients, when they show up for their appointment or before, through the electronic charting system, they actually fill up guiding questions that help us understand what are their challenges, right? It can be diabetes type 2, chronic back pain, whatever it is. Second question is, how is this affecting their lives? So you really want to dive in and understand how is this affecting their work? How is this affecting their relationships, right? Those are all really important to know because they might be suffering from something that have more of a significant or less of a significant for them. Remember, each patient has completely different set of values, right? And some patients might value going back to playing golf much more than they would value getting rid of diabetes, right? And so you gotta make sure that you talk to them about what really matters to them. The third thing is make sure you show compassionate. Always either confirm that you acknowledge by saying, I'm so sorry to hear that. It also shows empathy, that shows that you actually care about what they're talking about. Be engaged, and there's a few ways to show your patients that you are engaged in what they're saying. You can say something like, I understand, if I was in your place, I would be concerned as well. And are they concerned about how the future looks like? That's something that we actually ask them in the consultation form, but I would prefer if you actually ask them again, like, are you concerned how your future might look like, right? What are you concerned of the most? Is it your complication of diabetes? Is it your back pain? Is it that you have migraines every other day, right? What is it that is the number one priority for them, and what is it that actually brought them to you to seek for care? The sixth factor is, what are their health goals, right? Where do they want to be 3 months, 6 months? Where do they want to be a year from today? And hopefully in a better place, they can actually visually see where they're going to be and they want to be. The seventh factor to talk about with your patient is that, are they interested in finding what are those triggers of chronic conditions or pain, right? And this is where we kind of start distinguish between the mainstream form of care or the way of thinking, right? Which means I have back pain, here you go, some Advil, right? I have diabetes, here you go, some metformin. That is more of a symptoms management or disease management, and we want to distinguish that from functional medicine, right? Which means the functional medicine, we dive deeper, right? And that's where you want to ask for their permission to see if they are interested in finding out what actually triggers all these chronic conditions, and dive deeper to find out what is it that we can do to help them to resolve those issues, or at least improve their condition, right? And so I placed that question in that way on purpose, because the last thing that I want you to do is ask your patients, are you interested in just managing your symptoms, or are you interested in functional medicine? Remember that most patients do not know what functional medicine means. It's relatively new terminology and a new concept and a new way of thinking. And so it's better to ask them if they're interested in finding what actually triggered these chronic diseases, conditions, or their pain, to see if we can dive deeper and see if there's anything that we can do just beside managing their symptoms. The eighth factor that you want to consider is asking them about their level of commitment and level of readiness to make those simple lifestyle or dietary changes, right? Or take supplements. And so the way I would ask is from John, from 1 to 10, how much would you rate your commitment to resolve those health problems, those health concerns that we have talked about, right? This is also a great place to bring up the number one or the two most important factors that your patient was talking about. For example, John, your patient wants to resolve their problems so they can go back to playing golf or play with their children without pain, right? So I would talk about that from John, from 1 to 10. How much would you rate your commitment to resolve those problems so you can go back to playing golf or playing with your children without suffering from pain, right? So you connect it with their own desires, right? You make it very personal for them, right? And that's what personalized medicine is. And it doesn't matter if you do functional medicine or integrative medicine, it doesn't matter how you call it. Personalized medicine is the most powerful medicine on this planet, right? And so that's what we have. That's what we want to get the patient engaged. Now, I highly recommend to also get the spouse or support member involved. That will give you better accountability, somebody that they live with, somebody that can help and be supportive throughout the process with them. Because remember, it's not easy to change someone's ways of eating, their lifestyle. It's small changes that could make huge difference in their health, but sometimes they're not as easy as possible, right? Now, obviously, you want their patients or spouse or family members to be supportive as much as possible, because imagine that you see a patient with diabetes, they come to see you for help, they're starting to suffer from complication. You, on top of a new prescription or adjustment of prescription, you start working with them with functional medicine or integrative medicine, and they're committed to resolve their sugar addiction, to change their ways. They go home and their spouse just bought a bucket of ice cream and French fries and a couple of pizzas, right? How much would this patient's commitment will be helping them if their spouse or family member keep distracting them, right? So we have to make sure that we have the spouse there. It's helpful to have the spouse understand their condition, and you'll get much better engagement when you do that. In the future, I'll create another video on how to actually get the patient, a spouse, a support member to be engaged with them. But for now, just remember, you can actually ask the patient to bring, for the next appointment, to bring their spouse to be present and have a conversation. Once you wrapped up everything, you should have in your head at least an idea of what the recommended labs or supplements should be for them, or guidelines, right? If you don't, then remember, it's always okay to tell your patient that you have plenty of information right now and you want to take some time to do the research to come up with the best protocols and a game plan, a treatment plan to get the best results with them. Patients will actually appreciate and value you for being honest and taking the time to care for them, right? So as doctors or providers, we're always taught to be know-it-all or have all the answers to every situation. But remember that that's not necessarily the case. And sometimes in some situations, it's better to just tell the patient, let's revisit this in the next appointment, and that will give me time to do some research and get the best possible treatment plan for you so we can get the best result. Also, due to time limitation, and sometimes it's better to continue the treatment plan, a discussion of the treatment plan in a separate session. That will allow you to, that will give you more time and make sure that you're not running into other patients' appointments or your lunch break or whatever it is. The next step is to go over finances. That could be your payment per service, the price of the labs, insurance involvement, or packages. I would say just talk to the patients about the cost of each one of those, get their agreement for that, for whatever it is that within their budget, and then schedule them. And I highly recommend to schedule them for the next 3 months, right? Because then you know you have appointments scheduled, steady appointments scheduled on your calendar. The patients are able to get the appointments, the days, the times that are more comfortable for them. And it makes it easier for you to ask for that commitment, right? So I would say something like, Mary, I want to make sure that you have the days and times that are most comfortable for you, and to make sure that these are not taken by other patients, let's make sure that we save and secure those times, those appointments for you. Now, a little trick that we try to use is have the patient give them a notepad and a pen, or make sure that they write their appointments on their phone. We have found that when patients write their appointments, instead of us writing it for them, they actually have a higher engagement, and it's less probable that they'll forget. And so hopefully this video kind of give you an idea of how to structure the way you practice with patients, and help you to introduce functional medicine, integrative medicine into your practice for hopefully a better, a smoother, an improved way of practicing. I'm Tal Cohen, the program director, and I really want to appreciate you for watching this, and I'll see you in the next video.